So to kick us off, I would like to introduce Dr. Catherine Epps. She is the chair of the collaborative, the executive committee. She's a maternal fetal medicine provider at Baylor College of Medicine and chief of obstetrics at Bentab Hospital. She's also currently the District 11 ACOG Patient Quality and Safety Chair and member of the Texas Fetal and Infant Review for HIV and syphilis. She holds several grants with the CDC related to influenza and HIV and pregnancy. And she is the medical director for the Texas AIM program. So welcome, Dr. Epps.
Thank you, Dr. Ramsey. So I'm really excited to get to update everybody about what's going on with TCHMB. I'm really also grateful to get to come after the leaders who have just already spoken, especially emphasizing what Dr. Lakey said about how challenging this year has been for all of us. So to see the participation and engagement is a really hopeful moment. So I imagine many of you are familiar with TCHMB, being that you're coming here, but in case you're not, we are our state's perinatal quality collaborative. The state PQC is the state network of teams and members that help work on improving the care and the outcomes for moms and babies in our state. So it really does take all of us, all of our hospitals, all of our clinics, all of our communities to work on that huge task. Next slide, please. So with that, unfortunately, I have to start out a little bit with showing us how much is still ahead of us. So this is the March of Dimes premature birth report card. And of course, our state received a grading of D. And I think this just serves to cement and remind us why we're all joining together and how much work we have ahead of us. And I can't wait for the time when the person giving this talk a few years from now gets to say, we are now an A and our maternal morbidity and mortality have improved so substantially, but we're not at that point yet. And that's why we need all of us working together to get to that point. So our state's preterm birth rate is 11%. That's what gave us the grade of D from the March of Dimes. And we know that among our Black women, that rate is 14%, which is a lot higher than other members of our population. There are counties that worsened over the time period from last reporting and have gotten grades of F. So there is a lot of very important work that we have ahead of us. The patient and engagement are going to be what help us get there. Next slide, please. So what our mission is to advance the healthcare quality and patient safety for all Texas mothers and babies through the collaboration of health and community stakeholders. So we really do become that team of teams in this effort with our PQC, especially in the last year with the COVID pandemic. I think many of us are feeling that our ability to help and expand and have reached beyond our own hospital or community doors is a little bit more limited, but I'll remind us that by collaborating together, not only does it make us better as an entire state, but it makes us better back at home, wherever that might be. Next slide. So what does our structure look like? We have an executive committee and 4 different subcommittees. The community committee is one of our newer committees, but the OB and NEO have been there for quite some time. The data committee also is one of our newer and has a lot of really exciting things that it's been working on. And I'm going to introduce some of those members in the upcoming slides. Next slide, please. So these are our voting members. These are folks who have been very engaged and working very hard. I get to talk a little bit about our new affiliation and merger with the RAC PCR system. And with that, we got several new chairs in our NEO and our OB committee. So each of these members have been working very hard on the various projects that we're going to talk about coming up. I did also just want to emphasize and show that we do currently have a vacant OB committee position as well as our data committee positions. And then we've got our 2 at-large members. Next slide, please. These are our partner organizations, which are absolutely critical parts of the work that we do as the state PQC. So it includes many of our public health partners, many of our academic partners, and also our community organizations. Next slide. So just as Dr. Lakey mentioned, I did want to pause and just say that this is the TCHMB staff. They have been very hard at work, in particular with the summit over the last few months. And so everybody, give them a virtual high five for the amount of work that they have put forward to bring us this summit and to bring us all together. I've heard such amazing stories of people's experiences sort of leaving motivated and in action after prior TCHMB summits. We've also had really important stories where people have said, this is an area where you're not doing enough and we want to see more. And it has motivated us to go to the next level and realize that that is the endless part of quality and safety, right? You will never finish a quality job. A state PQC will never, say we're done and, we've reached absolute excellence. There will always be more to do. But in particular, thank you to all of the TCHMB staff that has worked so hard and given us that infrastructure. Next slide. These are our valuable DSHS partners. And just as Dr. Lakey said, their support and their strong partnership are, it would make the work of TCHMB impossible without them. And we go forward on all of this work together. So thank you to all of the DSHS team in this and all of their collaborative efforts. Next slide. So a little bit about our recent integration with the RAC PCR Alliance. So we have now embedded that those two organizations so that we can improve the breadth and depth of our reach across our state and really show the geographic representation that makes up our hospitals, our patients, our community members. So for those of you who might not know, our RACs are our regionalized advisory councils, and those are the bodies that have administrative oversight. They really started in regards to trauma, and then with maternal and neonatal levels of care, started having the perinatal care regions as ways to improve health for mothers and babies. We are now an integrated team working together, and with that, both our OB and our NEO committees got 22 new members, really allowing that geographic representation from our entire state. And so we're looking forward to the potentiation of both of our efforts to have an even larger reach. Next slide, please. So these are the TCHMB. We already talked a little bit about how work we have ahead of us, but reducing preterm birth and infant mortality is a key goal. Reducing maternal mortality and severe maternal morbidity. We've heard a lot from our MMRC about the work that we can do in this area, and we're looking forward to a lot of the projects that will tackle this and begin that hard work. Reducing disparities in the health outcomes of mothers and babies is a key goal going forward. For those of you who were able to participate in some of yesterday's events, we're hoping that leaves us all leaving in action. Improving the health and outcomes of mothers and babies, increasing the involvement of fathers and families, and improving women's health throughout the life cycle. Next slide, please. How do we, what are our key strategies? Obviously, as a state perinatal quality collaborative, this is truly embedded in that quality work. It takes collaboration from multiple partners and multiple voices to make sure we're doing this in the most effective way. Data-driven assessments are absolutely key, and there's a lot of very important work going forward on trying to create a good statewide PQC data system so that this can improve and enhance our work. Using those key quality improvement methods, using implementation in all of our QI projects, and then education and communication and dissemination. And each of the projects that we're working on have these key strategies involved. Next slide. So a little bit about some of the past initiatives from TCHMB. There have been a number of them, and many of them are now transitioning into the maintenance or sustainability time period. Reducing failed induction of labor was one of the first projects of the TCHMB and started with only 3 hospitals participating in that collaborative. Increasing breastfeeding and human milk in the NICU looked at 15 different hospitals trying to improve breastfeeding in the NICU. The Maternal Early Warning System project began to kind of expand the depth of hospital involvement and really worked on that improvement in timely recognition, diagnostics, and treatment. And we're really looking forward to the huge importance of that maternal early warning system in our state implementation of the severe hypertension bundle. Postpartum access to healthcare, or the PATH project, with the goal of improving access during the postpartum period. And then increasing access to reproductive health care and looking at one key question with our community committee. That is also a project that has now moved into the maintenance phase. Next slide. So with each of those projects, we learned a lot. We are working on expanding our reach and realizing how much work there is ahead of us. And so these are current and planned initiatives within TCHMB. And we would really encourage, if you are not already a member of these, to consider becoming a member. So the first is we have a race equity work group with the goals of making sure that as our state PQC, we are making sure all projects, all initiatives going forward are created with a health equity lens so that we are reducing our healthcare disparities. We are creating a reference sheet on public health programs, making sure that all of our important stakeholders are aware of the programs within our state for coverage to improve healthcare outcomes. Our OB committee is working on local implementation of this hypertension safety bundles. So taking a lot of the work that has been put forth by Texas AIM at the state and cohort level and adding that new partnership with the RAC PCR system to work on local peer support and implementation and take that hopefully to an even higher level. Mental health screening and referral for families with infants in the NICU. We know that mental health and perinatal depression is a huge problem for our moms in the state. So targeting and focusing on screening and referrals for moms that have babies in the NICU and improving those needed mental health services. And then our newborn committee is working on the newborn admission temperature project, so providing guidance for initial assessment and supporting normothermia for all infants after birth. So these are some of the current and planned initiatives that we'll be working on in the to be reporting back about hopefully the successes and how that contributes to our goals. Next slide. Our communications department has been hard at work, and Dan Oppenheimer and his team have done a fantastic job. So some of the methods of communication that you might have seen come out from TCHMB include our quarterly newsletter. Our website is continuously being updated. It is often one of the first things that you can find when you search things like maternal early warning system, digital advertisement, promotional emails, and of course, an active social media presence. Next slide. So what are our goals specific for 2021 with whatever that year might bring us? I think certainly none of us would have expected 2020 at this point last year to have turned out in the way that it has. But I think that gave us the opportunity and the challenges to really strengthen a lot of those QI efforts, and hopefully will be some massive lessons learned and make us more effective in all of these projects going forward. So our goals include refining criteria for selecting projects and ensuring that we emphasize racial equity and health disparities in all projects going forward. We're working on coordinating across our 4 different committees so that we can really potentiate that work and have a larger spread. So for example, our community committee working with projects with the OB and NEO committees and that important data infrastructure informing the work that all of our groups are doing. There is a lot of coordinated work led by Dr. Ramsey and Dr. Hampton on creating a real-time data infrastructure that will allow us to really improve our data-driven efforts. increase recruitment of health professionals, patients, family members, and increase membership and stakeholder engagement. So that is all of you. And we very much hope that you leave either increasing your participation or wanting to help in all of these efforts to strengthen us. We want to continue and enhance that we're utilizing data, outcomes, and evidence-informed and evidence-based practices to inform our policies and our projects. And again, that important work on a focus of decreasing our healthcare disparities, knowing that those are prominent in maternal and infant health, and that we will not be able to improve our overall outcomes unless we are specifically reducing healthcare disparities, and that they need that added increased focus. And then alignment of our shared goals with our partner organizations. Next slide. So with that, I wanted to say thank you and kick off the beginning of our 2021 summit. And with that, I have the great pleasure of introducing our first moderator, and that's going to be Dr. Christina Davidson.